So, hi everyone. My name is Dr. Neha Saxena, and I am one of the mentors in the StudyMRCOG group. I welcome you all to the next session of our B2B YouTube videos. So, here, my dear friends, we are making this video as the exam is approaching, and we all want you to be master in all the modules, as they are very easy to understand modules, but few of the students do such silly mistakes in exam, and we cannot take any risk of losing our important marks in exam, right? So this YouTube series is created to see what exactly are the basics of the modules that we tend to miss in the exam. Okay, so this is a very practical video that we'll not be going into the details of the theoretical parts of all the teaching topics. I am going to tell you and to make your life easy so that you attempt the station like you do in a actual exam. Okay, so let me take you through the teaching module today, and we'll be seeing what exactly we have to do in the exam when the teaching station approaches. So first of all, my dear friends, what type of stations do we have in the teaching? As you all know that the teaching module has to be one of the stations out of the 14 modules during our actual exam of part 3. So, what type of stations you will be dealing with in the exam? First, it may be a simple teaching station where some topic would be given and you have to teach your junior about that particular topic. For example, the examiner can give you CTG traces. He can give you some pessaries. My exam question was on POPQ classification, that I had to teach my junior about the POPQ classification. Okay. Other stations might be what exactly episiotomy repair and how it is done. You can get any station of teaching in the form of instrumental deliveries. That is either a vacuum or a forceps can be given, or the junior must be there to learn about the vacuum or the forceps because he has seen some or the other person in the labor room doing that type of delivery. So he's keen to learn about the same thing, right? Also, it may be any endless number of stations that can be there in the teaching stations. Okay, as practicing obstetrician and gynecologist, and as we all have cleared the part 2 exam, we have the basic knowledge, the theoretical knowledge of all the things. So this station for me is the easiest of all the stations in the exam to grab marks and to get a clear pass. Yeah. So the next type of stations would be the bullying stations, where the instructions would be given to teach a junior. However, the bullying part would be the hidden agenda. So, my dear friends, it is very important in all the teaching stations that you rule out bullying at the outset or at the start of the station, so that we categorize ourselves whether we have to deal the station as a bullying station or whether actually we have to teach the junior about the particular topic given. Okay, because different stations have got different marks. If you are not dealing the bullying station and you are behind teaching a particular topic to the junior, irrespective of the fact that it is actually a bullying station, there would be a borderline or a clear fail, my dear friends. Okay, so you have to be very, very clear in your exam while you are attempting a particular station that whether it is a purely teaching station or whether it's a bullying station. So I would just tell a few points that would give you an idea to identify what kind of station you are dealing with, right? So in usually the bullying stations, the role player will be very upset about the thing. He would be or she would be behind you in learning the particular topic. Doctor, I want to learn about the topic. Doctor, I want to learn about ectopic. Doctor, I want to learn about the pessary. Doctor, I want to learn about the termination of pregnancy. And he would be very anxious. You would be seeing the sitting posture. You would be seeing the body habitus of the role player as well. He might be very agitated, he might be very upset, he might be doing some actions from the hands or actions of the feet or thumping of the feet or clenching of the fist might be done. So that would make us realize that something is wrong, right? So these are all the things, my dear friends, that you need to look into a role player while you are attempting any station, especially the teaching ones, which demand ruling out of bullying at the outset. Okay? If you find that the junior is very uncomfortable and he's very keen to learn about the particular topic, ask again, what exactly is wrong, my dear? Are you comfortable in the environment? I ensure that whatever we discuss today would be between you and me, and I will not discuss any personal details with anybody without your permission. So you have to ensure the confidentiality. You have to make the junior very comfortable, and you have to reassure that he is in a safe environment to discuss what exactly wrong is going on with him or her with you. Okay? So after you encounter bullying, you have to talk about how to deal with the bullying episodes, and you have to make junior more comfortable. Okay? The topic that he or she wants to learn can be dealt off lately if he is very comfortable. So you have to ask the junior, how comfortable are you to discuss the particular topic? Do you still want to learn the topic, or should we reschedule this meeting to next time once you are absolutely okay and once you are absolutely relaxed to understand the situation or the particular topic? Okay? Otherwise, finish the bullying part and finish the station. Do not force the role player to learn the particular topic if he is not in a mental status of doing so. Okay? The third type of stations that can be seen in the teaching stations would be teaching along with the reflective practices. In these type of stations, my dear friends, the role player would be given a particular scenario and he would be discussing that particular case with you. Okay? Because he knows the basics of everything, right? As an ST1 or as an ST2, he knows everything about the ectopic. He would know everything about the basics of abruption. He would know everything about the basics of severe PIH. However, reflective practices are done in those situations when the junior has the basic knowledge of every topic, but he is not able to practically implement that knowledge while actually he's seeing the patients. So there is a tendency of missing that particular diagnosis, and then the junior can come for a reflective practice with you, right? So in these type of stations, my dear, I see a lot of you presenting and teaching the very basics of the topics to the junior. However, it is not the case. You have to teach the basics, obviously, but you have to stick to the particular question or the particular case scenario that the person or an ST1 or ST2 or any junior is coming to you with. Okay? So you have to ask what exactly the high-risk factors you found in her case. What were the clinical findings when that patient came? What were her vital parameters? Did you check the notes? Did you see the latest investigations of the blood and the ultrasound reports? Did you examine the patient? Did you listen to the fetal heart rate, etc.? So these are the conditions where you do not need to teach the junior the basic concepts. You have to take her or him through the case that he or she has missed in the management part. Okay, so that time you can just teach the junior the particular topic and you can help him reflect as well in his e-portfolio. Okay, so I hope that these three situations and the exam scenarios are absolutely clear to you all. After that, we would be seeing what are the do's when you are sitting in the exam in the teaching stations. First of all, my dear friends, it is very, very, very important that you read the instructions carefully in those 2 minutes that have been given to you as the reading time before the actual discussion starts. Leave the room at once when the bell rings. Start going on to the next station. Read the instructions very carefully to categorize what exactly is asked, because these are the 2 minutes that would decide what you will discuss in the cubicle in actual 10 minutes discussion time. Okay? First of all, when you enter the cubicle, introduce yourself that, hi, I am Dr. Neha, one of the doctors or one of the ST5s in the labor room or in the OPD. You can call me Neha. Yeah? After that, you have to tell the junior that you can call me Neha. And even if he or she calls you Dr. Neha or Dr. XYZ, say that, see, John, we all here are colleagues and we all are here to help you and support you in your education and training. So it's absolutely okay that you call me Neha. Okay? That way. So that gap of discomfort or that gap would be subsided, and the junior would be more comfortable to you and he would be comfortable discussing everything with you as well, right? After that, as I already discussed, you have to rule out bullying by asking a small question that, John, how's everything going on the department? I see that you have recently joined as an ST1 or an ST2, and I hope that everything is fine. If anything is bothering you, I'm here, and my seniors and all the colleagues are here to help you and support you throughout your training process. Yeah? After that, you have to ask the open-ended question that why he or she wants to learn that particular topic. What has made him come to you to learn that particular topic? Whether he has missed the diagnosis, whether he is just keen to know about the diagnosis because some of the relatives may have asked him that I want to get a pessary insertion done, but he did not know anything about the pessary. Okay. Also, you have to see the other things as well, like if he has been bullied or undermined or has been the candidate for a verbal abuse, that you don't know all these things, what exactly have you done? Either it can be done by the consultant or any other colleague or any other senior or the midwife. Okay, so in those situations you have to take the station into two parts, that is take care of the bullying part and supporting the junior throughout. Apart from that, you have to take care of the teaching part, that is teach whatever is given and what he has come to you for. Okay. After that, you have to make sure that you involve the candidate into the discussion. Okay, tell me about this. Okay, tell me about the two causes of preeclampsia. Okay, tell me about the vital parameters that the patient had come to you with. Okay, tell me the scan report findings. All right. Also, while you are making the role player understand the particular topic, it is always advisable that you have an audio-visual diagram. Okay, so take the pen and the paper that has been given to you during the exam and start drawing something. So this is the pessary, this is how it is inserted, show the pessary, do the things that you want to show with the pessary. Okay. Or any other things like the CTG graph. So this is the name, age, NHS number that we have to confirm. So take the pencil, take the sheet of the paper that has been given to you and start teaching on that. Okay, do not mark if that's the common sheet for the other candidates as well. Just use the pencil and show that here the name would be written, the NHS number would be confirmed, and then we have to trace the CTG charts, etc. Okay, you have to welcome the questions also. Tell them that you can stop me if you do not understand anything and I'm happy to help you. Okay, you have to encourage throughout the process that it is a learning process. Mistakes are bound to happen because but I really appreciate that you have come here for learning about the particular topic or have come for a reflective practice, because that would teach us and that's the way we would learn and become better clinicians in future. Okay. Also, you have to reassure her or him that me and my colleagues are always there to help you and support you. In case you need to know anything further, just let us know. We are all here to help you. Okay. At the end of the discussion, it is always important to share the reading materials and the links. Okay, the RCOG websites, the GTG guidelines, the NICE guidelines, or any other thing that you feel is important to. Okay. And also, if everything is sorted and you're happy about the station, just ask about the feedback, like how did the session go? Did you find the session useful? So that is the way that you get the feedback for yourself in case you need to teach another junior, or you need to improve your teaching practices as well. Okay. So these are the do's that you have to remember, my friends, in all the teaching stations. So coming on the don'ts part. So what you do not have to do in exam. First of all, you know everything. Okay, so do not panic. Just take a chill pill and just go for the station, and it will all be sorted out. As the role players are sitting to help you, okay, they are always there to help you, and they all want that all the candidates clear the exam. Nobody is sitting there to fail you or to trouble you. Okay, so be straightforward with the junior, be honest, do not panic. And it is important that we do not create an environment that appears to be blaming or undermining the junior in question. Why did you not see the notes? Why did you not take the vital parameters? Why did you not check the ultrasound or the heartbeat of the baby? Why did you not do a PV? You should have done this. You should have checked the notes. You should have informed your seniors. So these are the tones that we have to absolutely avoid using while we are in the teaching part. Okay, because it's a clear fail in the patient safety or in the communication with colleagues, right? You cannot talk in that tone with any of your junior. Okay, you have to address all his concerns, even if you are seeing that the time is running out or you will get lesser time for the discussion part. You can never interrupt the role player. You have to address all his concerns, right? So these are the very important don'ts point that you need to look upon when you're dealing with a teaching station. What if now you see that this is a purely bullying station, right? Some people have this problem of, ma'am, how to deal with the bullying. So I'm here to tell you how you have to handle the bullying in the exam. So first of all, as I already discussed, the ways to recognize bullying. You have to maintain your composure while you are discussing bullying. Do not blame the junior why you are saying that this thing has happened, or do not say that, do not justify why the bullying has been done. For example, if the midwife has bullied or she has undermined or she has said some bad things to the junior while she was taking care of the emergency patient, you do not justify that because the patient was in a need of treatment, that's the reason the nurse would have done like that with you. So that is absolutely bad. You cannot justify what the nurse has done. Okay, you have to ask the junior about recording the incidences, like the dates of the incident, the number of times the role player has found that this incident has happened with him or the other colleagues, that the nurse or the other senior specialist is being rude to him and the other colleagues as well. Okay, what were his comments? What were the actions taken by the senior that he felt that he has been bullied? You have to say that we are all here to help you and support you. You have to directly address the particular issue, and you have to tell him the NHS policy that bullying is absolutely not tolerated in the NHS, and this is not the way anybody can work in the department with full efficacy. Once we find that someone has bullied the other person, strict actions would be taken against the person according to the NHS protocols. Okay, you can say that we have to either, you can go to the particular person whom you feel that you have been bullied by, and you can discuss that particular thing with the person itself. Or if you are not comfortable, I can come along, or any senior person can come along and discuss the things with the person who has bullied you that you think of. Okay, or if you feel that this nothing would be sorted out, you can escalate that process and you can talk to your educational supervisor, your clinical supervisor, your mentor, or the dean or the principal of the college. Okay, work-based champions are also available who take care of the bullying process, and in case anybody is found guilty, strict actions will be taken against him. Okay, you can take some time out and you can just take some leave. I can refer you to the mental health specialist, the occupational specialist, and you can just take some time off and enjoy this leisure time with your family and friends. And once you are sure that you are completely in a state of coming back and learning the process again, you are welcomed. Okay, so that way you can just tell the junior that we have a support system and we have to take care of ourselves, and our mental health has to be the first person or the first thing to be taken care of, so that we are in a state of learning more, right? So that is the way that you have to deal with the bullying things. Now, my dear friends, we come to the domain marking, that how the marks could be awarded of in teaching stations. So first of all, we'll be discussing about the most important patient safety domain. Okay, so here we have to recognize bullying. That would be carry important 1 mark. Okay, then we have to recognize the disease symptoms. Okay, if any severe PIH case is given to you, any diabetic mother that has come to the emergency, any abruption case has come to you, or any ruptured ectopic has come to you, you have to identify the symptoms, what the patient has come with, what are the findings when the patient has come in the emergency. For example, unconscious patient, or fainting episodes, or headache, visual disturbances, or leaking, bleeding, etc. Okay, it depends upon what exactly you are dealing with, what case you are dealing with, right? Also, then you have to stress the need for the immediate admission or immediate monitoring of the patient, maybe by the senior help, or you can just call up the consultant. Okay, MDT has to be involved in situations where you feel that the patient is a complicated case, right? These are the very important patient safety points that you have to add in teaching stations as well. Then the information gathering is very important aspect of exam marking, my dear friends. So here we have to take the history of the patient, tell how the history is gathered, ask about the symptoms, and after that you have to see what medical history, significant surgical history, family history, personal history of smoking alcohol, any drug addictions, and importantly to rule out any allergies. Okay, because in such situations you might have to give him or her some medications as well, right? After the symptom inquiry, you have to see what are the findings on the clinical examination. What are the general conditions the patient has come with, whether she is completely stable or whether she is unconscious or if there's altered sensorial. You have to see the pulse rate, you have to see the blood pressure, you have to see the saturation, you have to auscultate the chest, you have to see the per abdominal findings, and you have to do the PS or the PV examination depending upon the case, right? After that, we have to see the investigations of the patient, like what investigations were done and what investigations were the patient has the patient come up with. Okay, for example, the recent scan to see the placental localization, or the recent scan to see the localization of pregnancy. Okay, in case of diabetics, what were the recent sugars? In case of PIH, what was the recent blood pressure and the functions of the liver and the kidney, etc. Important to see here is the blood group and to rule out any Jehovah's Witness as well. Okay. After that, the communication with the colleagues is a very, very important domain marking point. You have to give the clear instruction to the junior, okay, how to manage this case. As I already discussed, that you have to create a supportive environment and say the confidentiality part will be ensured. Okay, you have to be non-judgmental, and okay, and you have to encourage an open and two-way communication with the junior, right? You have to reassure that he is in a safer environment to discuss everything so that he opens up well with you, right? And say that we'll be giving a constructive feedback that so that you learn the ability to handle such situations if they happen in future, right? As I already said, communication part contains bullying as well. Now, the applied clinical knowledge would depend upon what previous knowledge you have of that particular topic. Okay, for example, what is the pessary? How is it inserted? What are the indications? What are the absolute contraindications? What are the complications? Okay, if a disease is given in particular, for example, diabetes, explain the pathophysiology. What are the risk factors like the previous history of GDM in the previous pregnancy, family history, right? So these are all the situations that you need to see. In PIH, you have to see the family history, the parity, the family history along with the previous history of preeclampsia, the BMI part, etc. Okay, so see the risk factors and ask the junior one or two risk factors can you enumerate for me. My dear friends, many of us have the habit of repeating too many things with the junior. Like you'd say 5 or 4 points of the high risk factors and the moderate risk factors of the PIH, and then you expect the role player to answer all the points. So, my dear friends, that the role player may not be able to tell you all the 5 points, right? So you just say that, can you just tell me one high risk factor? What you think was the high risk factor in your case out of the many that I have told you now? Okay, so the junior is also happy and we are also happy. Tell in details the management protocols, where you would admit this patient, why you would send this patient, when you will call this patient again, etc. Okay. Also tell about the drugs. Okay, and briefly the management part, and it all depends upon the case in particular. Okay. In ectopic pregnancy cases, you can offer a scan, go for a beta HCG, then decide like expectant or medical line of management or straightforward surgical line of management has to be done. What are the findings of per vaginal examination in a abruption case? So you decide whether you want to go for a normal delivery or whether this patient is a candidate for straightforward cesarean in order to save her life, right? Also, you have to tell about the complications and the outcomes of the particular thing, like the pessary, or if the CTG trace like that, or if you're teaching the vacuum or the forceps, okay, the indications, the contraindications, and the complications. So these are all the things that you would be judged in the applied clinical knowledge domain. Okay, so I think these are the things that you need to look upon into the teaching stations. I have tried to simplify the things for you so that you have got a clear or a clear pass in the teaching domain. Important here, as I'm stressing again, would be those initial 2 minutes of the reading time where you have to decide what exactly would you be doing in the next 10 minutes of the actual discussion time. Yeah. So I hope this session is absolutely clear to you. In case you have any doubts, please get back to us on our website, and we'll be seeing you again in the next episode of B2B YouTube series for the upcoming Part 3 exam. Thank you so much, my dear friends, for all your precious time. I wish you a happy learning, and I wish you all the best and all the success for your upcoming exam. Thank you so much.